Let's talk about something that's often brushed off as just morning sickness, hyperemesis gravidarum, or HG. HG is much more intense than typical nausea in pregnancy, and it can seriously affect your health, hydration, and ability to eat. When food suddenly becomes difficult or even impossible, nutrition can feel overwhelming, but understanding what's happening in your body can help make the experience feel a little less isolating and a little more manageable. HG is severe nausea and vomiting during pregnancy that can lead to dehydration, electrolyte imbalances, weight loss, and nutrition deficiencies. Researchers believe it's related to pregnancy hormones, especially beta-HCG and estrogen, as well as changes in digestion and the nervous system. Unlike regular morning sickness, HG can make it hard to keep food down, fluids, vitamins, or even medications. When vomiting becomes constant, your body starts losing important nutrients, fluids, and energy faster than you can replace them. That's why people with HG can feel weak, dizzy, exhausted, and emotionally drained. And because nutrition and hydration are so important during pregnancy, this condition can affect both maternal health and baby's growth if it becomes severe. Nutrition during HG is less about eating perfectly and more about survival and support. Sometimes the goal is simply finding anything your body can tolerate. Even small amounts of food and fluid can help stabilize blood sugar, maintain energy, and reduce stress in your body. This is one of those situations where flexibility matters more than rules. If plain crackers, mashed potatoes, smoothies, or popsicles are all you can tolerate right now, that's okay. Nutrition during HG is about meeting your body where it is. When vomiting is frequent, a few nutrients become especially important. Vitamin B6 may help reduce nausea and is commonly recommended in pregnancy. It's often prescribed by providers in conjunction with Unisom for hyperemesis gravidarum. Electrolytes like sodium and potassium help maintain hydration, nerve function, and muscle function. Carbohydrates are often easier to tolerate and can provide quick energy when eating feels difficult. Protein becomes important once nausea improves because it helps support baby's growth and maintain muscle mass. And thiamine, also called vitamin B1, is especially critical in prolonged vomiting because severe deficiency can become dangerous, causing Wernicke's encephalopathy or a type of neurological disorder. Again, you don't need to memorize all of this. The important thing is trying to nourish your body however you safely can. In real life, eating with HG often looks very different from the perfect pregnancy diet people talk about online. Small, frequent meals usually work better than large meals. Cold foods may be easier to tolerate because they have less smell. Dry or bland foods like toast, crackers, rice, applesauce, cereal, noodles, or potatoes are often gentler on the stomach. For example, breakfast might just be dry cereal or toast before even getting out of bed. Lunch could be plain rice, broth, soup, or fruit. Dinner might be mashed potatoes, noodles, or whatever sounds tolerable that day. And snacks like smoothies, electrolyte drinks, yogurt, popsicles, or protein shakes can sometimes help fill nutritional gaps. The goal is nourishment, not perfection. Dehydration is one of the biggest concerns with HG. When you're vomiting frequently, your body loses water and electrolytes quickly, which can lead to dizziness, headaches, rapid heartbeat, and extreme fatigue. Sometimes sipping tiny amounts throughout the day works better than drinking large amounts at once. Cold drinks, electrolyte beverages, ice chips, popsicles, or flavored water may feel easier to tolerate. And if you can't keep fluids down at all, that's not something to push through. It's a reason to contact your provider because IV fluids and medical support may be necessary. HG is a medical condition, not a lack of willpower, and something you caused. Sometimes nausea becomes so severe that medications, IV fluids, vitamin supplementation, or even temporary feeding support are needed. That doesn't mean you failed, it means your body needs extra help. Nutrition can support recovery, but severe HG often requires medical treatment alongside dietary changes. Reach out to your provider if you notice you can't keep fluids down for more than 24 hours, you're losing weight rapidly, you feel dizzy or faint, your urine becomes very dark, or you're vomiting constantly throughout the day. You deserve to be taken seriously. Severe nausea in pregnancy is not something you simply have to tough out. If you're struggling with hyperemesis gravidarum, remember this: fed is better than perfect, hydration matters, and small wins count. Your body's already doing an incredible amount of work growing a baby, and getting through HG can take enormous physical and emotional strength. Focus on what you can tolerate, accept support when you need it, and stay connected with your care team. You are not failing, you are navigating a very real medical condition. Thank you for listening.